Hi there, Jenny here. So today's topic is something that's actually very near and dear to my heart. It's actually the reason why I got involved in gentle birth in the first place. So I'm super excited. So I wanted to talk about C-sections and Vbacs, so vaginal birth after a C-section. So I'll tell you a little bit more about my story. We'll talk about some stats around C-sections and VBACs. We'll talk about risks and benefits for both, and we will talk about the how to stack the odds in your favor, basically. So a little bit about my story, and it's kind of ironic because I actually had a C-section exactly 5 years ago with my first son. Um, and because of that experience, I knew I did not want to have another C-section if I had another child. I knew that. So I did a lot of research. I was just, very well informed when it came to VBAC, and I knew I wanted to attempt a VBAC. So when I found out I was pregnant, I knew that's what I wanted to do. I talked to my OB about it, thinking that he would be supportive, which he was actually, but I quickly realized he wasn't as supportive as I thought he was going to be. So I knew I was going to have to go a different route, which I actually ended up going the home birth route. And it's a very long story, but I did not end up having a VBAC. But honestly, it's really what has led me to my passion and to be here with you guys and talk to you about it and help other moms, honestly. Navigate through this. So that's a little bit about my story. So let's talk a little bit about some stats. So the VBAC rate has actually gone down about 70% since 1996. And C-section rates in the United States have increased by 50% since about 10 plus years ago. So a couple reasons for that. So there is this stat around that is brought up again and again about uterine rupture, so the separation of the scar. And we'll talk a little bit more about that later. But then there's this also limited access to even try to labor after a C-section. So it's very difficult to find a supportive OB. And there's a difference between being a supportive OB and a friendly, VBAC friendly OB. And then there's hospital bans. Hospitals are banning VBAC. So it's really hard to find a supportive OB and a hospital that would even let you VBAC. And I think it's getting a little bit better, but there's still a lot of work to do. There's still more evidence that needs to be, there's just better evidence in general. So why are we doing so many C-section rates in the first place? We need to kind of put pressure on hospitals and OBs and to make changes, really, is what it comes down to. So let's talk about C-section. So a C-section is an abdominal incision. There are two kinds of C-sections, and now that I think about it, I actually have gone through both of them. So there is an emergency C-section and there's a planned C-section. So an emergency C-section was my first, and it's a very scary thing. There's a lot of strangers that come in that room. The atmosphere, the environment, just the mood changes as soon as they know you're going to have a C-section. So you want to make sure that you remain calm. Your birth partner or your doula should be there to reassure you and to help you remain calm. It's a very, very scary thing, to be quite honest, having gone through that myself. And so the other type of C-section is a planned C-section, which you can schedule a C-section in advance, or in my case, labored for a very long time and then just decided to have a C-section. So it's really differences when it comes to timing for both of those. So in terms of a C-section, there's usually enough time. If it is an emergency, depending on the situation, there's usually enough time to have a spinal anesthesia, and then you're catheterized as well. And then your birth partner, puts on scrubs, and you're basically brought into an operating room. There is some talk recently. I feel like I'm hearing more about it. Probably not as much in the United States, but I'm hearing more and more women talk about a gentle or a natural C-section, where you could have a clear drape, where you can actually see the procedure. There's also, depending on the situation, if the baby is healthy, if the mom is healthy, you can have skin to skin. You can do delayed cord clamping. So it really kind of depends on the situation. So it is possible. So if you know you're having a C-section, you definitely want to switch your profile on the Gentle Birth app to cesarean birth. And there are some MP3s on there that'll help you reduce anxiety and stress, to prepare for the surgery. And so if you're having an unplanned C-section, there's one called Fear Release, an MP3. It's really good to help you, go through those emotions. So let's talk about some complications of a C-section. So there's obviously some infections that could happen. I actually had an infection. I couldn't have my placenta encapsulated, unfortunately. There's, of course, excessive blood loss, complications from the anesthesia, blood clots because you are not as mobile when you have a C-section. There's bowel and bladder injuries. I actually had a bladder injury and I had to have a catheter in for 5 weeks. Not fun with a newborn baby. And so then there is, baby can have difficulty breathing from a C-section, especially a planned C-section. And then there's an increased risk of uterine rupture, of course. So, it's a major surgery, to be quite honest. And it's just not something that you should be, take lightly, basically. So let's talk about Vbac. So Vbac is considered a safe choice for healthy moms that have had one C-section, a prior C-section. In fact, the vaginal delivery rate of a trial of labor has remained constant at 74%. So those, are really good odds, if you ask me. So there are some conflicting stats out there, and the most common is around a uterine rupture or separation of the scars. So depending on the research, your risk of a uterine rupture is about 0.07%. And I will never forget this stat because it was talked about so many times when I talked to different OBs. But in Gentle Birth, we're all about putting a positive spin on things and changing your mindset. And so what if you looked at that as, I have a 99% chance of not having a uterine rupture, that would change your whole mindset. Sometimes we focus on the risks and what could go wrong and not look at the big picture and what, the great things that could come from this. And you could have a perfectly, healthy delivery and everything is great. So some of the benefits of a Vbac. So, a couple of these are the reason why I wanted to attempt for a Vbac. You avoid surgery. Surgery is, it's difficult when you have, especially if you have another child to care for. There's a quicker recovery. The baby is more likely to have, less likely to have trouble breathing. There's a shorter stay in the hospital, of course, and then there's less pain and possible infection involved. So the risks of a Vbac, you want to make sure you understand the risks and benefits. Vaginal pain, of course, pelvic floor weakness. There's a higher risk for brachial plexus injury. And there is, of course, the scar separation or the uterine rupture. So how can you stack the odds in your favor? So make sure you choose a supportive caregiver. I can't stress this enough. Again, there's a difference between being a supportive OB and a Vbac supportive OB and a Vbac friendly OB. And you'll quickly realize what kind of OB you have, basically, and you can make your decisions from there. Make sure try and have a spontaneous start to labor. Labor at home as much as you possibly can. They say that your chances of having some type of intervention or your chances of having a C-section increases if you go to a hospital before you're 4 centimeters dilated. And make sure that you talk to your birth partner about your previous experience and what that was like, and make sure you're on the same page. Basically, try to avoid an induction unless you necessarily you really have to. Make sure you have a doula. I can't remember the stat, but I think it's about 30% higher chance of you having a successful VBAC if you have a doula on your side. So get a doula. Try and prepare for an unmedicated birth. There are some risks involved that come with the epidural. So try and have an unmedicated birth. So that's kind of all I have. It's a brief introduction. There's so much more to my story that I could share, and I'd love to share with you guys, to be quite honest. Again, Gentle Birth has a workshop, which is about 4 to 5 hours on this topic. So if you want to learn a little bit more, contact us for that. And thank you guys for joining. To be quite honest, I'm just really excited about this journey. And yeah, that's all I have. Thank you guys. Bye.